Okay, so going back to this, sorry. All right, so here are all the different things we talked about. So the next step in line was Carl Landsteiner, and he was noted for first distinguishing the ABO system of blood typing, which was really exciting because we were able to discover that we could give blood transfusions. And it talked about how even though we all bleed the same blood, that not everything's compatible. Medicare and Medicaid was passed with the Social Security Act amendment in 1965. So Social Security was developed in the New Deal by FDR, and then Congress passed the Medicare and Medicaid bill as amendments to the Social Security Act. So kind of this idea now that, hey, when you get older, you might not have a job that has health insurance, or you're going to have way more health issues when you're older, and no one's going to want to insure you. And you've retired, and who's going to pay your medical bills that are going to be extremely expensive? So Medicare was there to help, at least with basic stuff. And of course, Medicare has changed since 1965 in so many different ways. We have Part A, Part B, Part C, Part D. Um, they started talking about like, hey, the response, health in this country, there's going to be some semblance of government input because we need our society to survive. Now, the whole argument on healthcare in terms of policy, we're not doing that in this class. This isn't a policy class. So this is just basic, talking about getting involved in public health in general, because understanding just that health is at a higher level than just the individual. Healthy People 2000 to 2020. So this is a little tale for you guys. I remember being in, and some of you can say this too, for those who went to diploma school and then got their associates. There was a time when people didn't know about Healthy People at all because that wasn't a thing. I remember when Healthy People 2010 was coming out, and I was in school when 2000 was kind of like, hey, we're waiting for 2010 to come out. But these are initiatives they've evolved into an important strategic planning tool for public health professionals at the federal, state, and ad local levels. It sets the agenda for what we hope health to be in the next 10 years, if that makes sense. So 1990, there was an agenda that these are goals to be reached in 2000. Sometimes all the goals were met, sometimes different. Some goals weren't met. And it's, by the way, based on trends. And then there's coordinated school health. So wait, what do you mean coordinated school health? I remember budget cuts and I didn't have a school nurse. But the idea of when we did scoliosis tests, you guys remember that? I mean, they still do them to this day. My parents were like, we didn't have scoliosis tests. We didn't do, I mean, they did vision tests in the schools. Now, I know that depending on what school you went to, things have fluctuated. Even the idea that they talk about reproductive health in school was part of the coordinated school health program in comprehensive school health instruction. And part of that was just saying, hey, sometimes kids don't have parents. We're going to talk to them about general health. We're going to talk to them about preventing pregnancy, or understanding just even how you get pregnant, or understanding that if you wash your hands after you go to the bathroom, you're not going to get as sick, or understanding that, hey, once a month you're going to get a period. And it's not this thing to be ashamed of, but a thing that you need to watch out for so nobody, so you can keep yourself clean. So that's kind of where this all emerged. So health educator or occupational health became a recognized profession. Okay, so understanding environments and how environments affect us. Then there's the Patient Protection and Affordable Care Act. So part of, HIPAA, Affordable Care Act, the HITECH Act, the Patient Bill of Rights. So this bill provided better access to clinical prevention services. So part of that, just the idea that, hey, listen, no matter what, any citizen of the United States can get a mammogram. Hey, listen, every insurance plan out there has to cover a screening colonoscopy. They might not have to cover the experimental therapies. Shoot, they don't even have to cover therapy, right? I mean, if you have a high deductible, but they at least have to cover wellness. You get one wellness visit a year. I don't know if there's any of you who have, depending on what plans you have. Some, you work for a large organization, they tend to be comprehensive. Some of you might opt and choose the really high deductible plan that only offers free wellness because you are like, hey, we don't utilize our healthcare coverage that often. We really don't need to be paying these high premiums. I want to pay 30 bucks a month and know that I have catastrophic coverage, and I just want to see my regular doctor once a year. So this was kind of, offering this type of at least basic bottom care for everyone. So if you don't have health insurance, okay, so patients come to my office and have health insurance and they're citizens or residents, or, they qualify to be under this act and they need a mammogram. It's no longer where they're like, well, it costs $600 to get a mammogram, I'm not going to do it. They'll get a mammogram for free. Now, they need a diagnostic mammogram that's different. That's when they're going to have to start applying for financial aid or doing a payment plan, but at least they can get into clinical prevention services without a cross barrier. And part of that, too, is strong support for school-based health centers. So for any of you who live in Cincinnati, we have a lot of school-based health centers in the Cincinnati public schools. Mainly, all of them offer primary care and prevention services to all the students, but some of them are also open to the families. So that is the health and health promotion timeline. Just for you to get an idea of how early this concept of wellness started. All right, so getting back to chapter 1. I'm just showing you guys all my moves, aren't I? All right, so back to the slideshow. All right, so we talked about this, Rome, China, health and harmony with the universe, the Middle Ages. We learned about quarantine. So, one thing I just think that we need to understand is the Industrial Revolution brought a lot of thought and also the idea of crowds and disease. And during the third movement of health promotion, really the evolution of nursing as a profession started. And you can thank the National Health Service League in England for really promoting what nurses do and are honored for to this day. Physicians went to homes when the nurse told them to, or people went to the hospital when the nurse told them to. Nurses were there in the front lines, just like we are today. And I get emotional about it because it is seriously one of the most beautiful professions. We go in wherever to serve whomever and decide who needs what. I mean, what an honor that we get to do those things. And so, when you're getting your bachelor's, this is the time that you're really understanding these beautiful theories that really the nursing profession forms. So health reform, we talked about federal government and healthcare. World War II, there was lots of advances in medicine. Some sadly came as a result of the Holocaust and the Nazi regime. Unfortunately, due to the medical advancements done because of these terrible, gruesome medical experimentation on the Jews and the Romans and anybody deemed, not worthy to live by the Nazis. There is actually a lot of medical advancements, and they're terrible and sad, and to this day, I wish we didn't have those advancements just because of what happened. But there were these advancements, but also within the war, learning better ways to suture, perform surgery, to vaccinate, to treat people. With World War II, lots of different sexually transmitted diseases came out, and how to screen for them, how to treat for them, that was born. And then also, because there was less and less infectious diseases, because we had ways to quarantine, ways to prevent them, and then, of course, ways to treat them, we shifted to chronic disease. And so the Social Security Act came into play because they were realizing, hey, if we can treat these chronic diseases, people are going to live longer and be more productive, but we need to be able to offer care for that. So really quick, Medicaid and Medicare, obviously they're hospital and supplemental medical insurance. It also, Medicaid and Medicare also supplements hospitals and funding because even there's still so many people who don't have health insurance and they have to go to the hospital and there's outstanding bills. Well, any hospital would fold if you ask if it was just based on them getting paid by either third parties or the patients who use it. So Medicaid and Medicare also provide this extra hospital funding for those who use the ER, maybe not the way they're supposed to, but they use it regardless. Health, and then also healthcare for the poor, medically needed, aged and disabled, and their children. And also it goes into this, some of you might be able to attest to this. If you have a child with special needs or long-term illnesses, they're going to max out in their private insurance plan, and Medicaid helps support that. Government initiatives for health promotion in the 20th century. So Canada's influence, obviously, Canada's single payer system has some of its problems, but also has some of its goods. Everybody has healthcare in Canada. Of course, there's lots of kinks to work out. There's some international goals for health and U.S. national goals for health. So the Lalonde Report. So the Lalonde Report was kind of the first modern declaration of public health, where it's prevent illness and promote goodness and wellness. And when you do that, you'll have a healthy society. So it shifted from disease treatment to prevention, and that's when the Canadian Health Act of 1984 came into place. So the Alma-Ata Declaration. So the Alma-Ata Declaration was in 1978, and this was kind of like the first primary care conference, and the idea of healthcare for all focused on prevention and promotion. So prevention and promotion is not like a modern idea that just came up in the 2000s. It's definitely gotten more popular. And in 2010, the UN Summit on the Millennial Development Goals was very much focused on disease prevention. So we talked about healthy people, the Surgeon General's report on health promotion, disease prevention. 2000 was the first one, 2010, 2020. So now they're working on 2030. And actually, if you read all the healthy people's, they change. And we can actually, if you want, look at them together. That's actually a really good area. So, healthy people. Let's look at 2000 objectives. All right, so they come up with objectives, right? So there's healthy people 2000, 210, and 220. Okay, so they had 22 priority areas. Physical activity, nutrition, tobacco, substance abuse, family planning, mental health, mental disorders, violent and abusive disorders, educational and community-based programs, unintentional injuries. I mean, look at all this stuff, right? This was in 2000. And these are 10-year targets that you do. So in 2010, and they have very specific priorities. So if you look at maternal and infant health, we actually, our infant mortality rate in the United States is actually still pretty high compared internationally. Like, we should be a lot higher, but we aren't as high as you would think. So talking about reducing disparities in maternal, infant, and child health indicators, we had really high infant mortality rates, especially in DC. I think DC was one of the higher ones, and a lot of that had to do with prenatal care. So part of the goal set in 2000 was helping beef up prenatal care, and it really has. So you look at 2010's 28 focus areas. So access to quality health service. So this idea now, like, okay, wait, we kind of are figuring out how to prevent disease, but part of the way to help those things is people need access to regular care. Arthritis, osteoporosis, and chronic back conditions. People are working longer, so understanding how to prevent those things. When an elderly person falls and fractures something, it costs a lot of money. This idea of preventing fracture and fracture-related complications like pneumonia came with the idea like, hey, how do we figure out if someone has osteoporosis? And when they have it, what can we do to treat it? Arthritis and then chronic back conditions. How can we prevent these at work? Because they're quite costly. Disability affects all of us because we have to pay for it. Cancer, chronic kidney disease. So 2010, they realized, oh my gosh, we are spending so much money on people in renal failure. You're on renal failure, you automatically qualify for what they call Medicare um, renal disease care. So now you automatically qualify for Medicare. So you could be 16 and on dialysis and you're on Medicare. And then you can apply for additional coverage through Medicaid. Sometimes you qualify, sometimes you don't. Um, End-stage renal disease is extremely costly. Every time you get hemodialysis, it's $10,000, and you're doing that 3 days a week for the rest of your life. So what can you do to prevent chronic kidney disease and its complications? It's so expensive. So looking at core causes, right? So diabetes, hypertension, peripheral vascular disease, smoking. Um, and so next comes in line diabetes, disability and secondary conditions. So if you go down the line, you'll see what was made the priority and then what specifically, right? What specifically did they want to talk about to focus on? So leading health indicators at a glance. I know you guys are thinking, oh my gosh, this is so crazy. So one of the things was, of course, reducing the proportion of adults who are obese because they realized, oh my gosh, all these issues with obesity, all the complications of obesity are quite costly for us in the future. And now kids are getting obese. So, and then if you go down the line, it talks about why all these things are brought up. Okay. So if you look at 2020, things changed a lot. And it went, so remember, there's 21 to 28 to 42 topic areas for 2020. And part of it's just because there was so much more. I mean, the more you learn, the more issues you're going to find. So if you look at the 42 topic areas, is a little more organized. One of this is genomics, and that is the study of genes I talked about earlier. Understanding risk means understanding people's family risk. So if there's someone who comes in, for example, when I do wellness exams, and I told you I mainly do adult, I also do pediatric visits, okay? So a 16-year-old African-American male comes in for a sports physical. I talk to him about his family history because I want to know if he has familial hypertension, which tends to run in the African-American community. He has familial hypertension. I'm going to start doing hypertensive screening on him. I mean, honestly, at 13, he should have been having it, and maybe he had. Because you want to catch those things early because the damage that hypertension causes permanently to the kidneys and the heart and the eyes and the vessels happen before people feel things. I mean, I'll have people who don't go for a regular doctor's appointment until they're 35. And it turns out that they have high blood pressure. I go and I get an echo and I see that they have pretty significant heart damage because of just 20 years. No, even 10 years. Say they're 20 when they start getting high blood pressure, but they didn't realize it. 10 years of undiagnosed high blood pressure caused, hypertrophy and left ventricular hypertrophy and possible CHF. So at age 30, imagine the actual cost burden, not just to the community, but to himself. So this is the Healthy People website, health.gov. You could just put healthypeople.gov. The book encourages that you look through it. I actually have the link posted on the wall. Oops, sorry. All right, so we talked about the goals of healthy people. So healthcare cost containment. So there's something called diagnostic related groups, and this affected how diagnoses were going to be reimbursed by third parties. So somebody came into the hospital for hypertensive disease, there was just a set amount they would get reimbursed, and whatever happened outside of that set amount, they would the hospital would have to eat the cost. And so part of that was just to control costs and also for insurance companies not to go broke. So you get, certain things are automatically covered and other things are not, and then you have to find other reasons to get it covered. And so there's changes in the nursing practice because you couldn't be inpatient forever. So you had home health, sending the nurses out there to monitor your patient, because you have to understand, people don't go to the hospital because they need the doctor. I mean, people need a doctor or a nurse practitioner or a PA to take care and diagnose them and run their treatment. But the reason why they need inpatient care is because they need inpatient care. Who's in charge of inpatient care? Nurses are. Nurses have to be there all the time. There are hospitals where there isn't a doctor on site at night. And that's because somebody needs to be monitored by a nurse.